Margaret Smith. She is the manager of the Wheatbelt Public Health Unit. She has worked 39 years in the health sector, of which the past 26 years have been at WACS across 3 different regions in numerous positions. Margaret has an extensive background in child and school health nursing, Aboriginal health, and for the past 5.5 years in management. She has spent much of her working life working and advocating to improve access to services for families living in regional WA and enjoys supporting the Wheatbelt Childhood Aboriginal Immunisation Project. And Wendy Kickett is a Balladong Noongar woman and lives and works in the Wheatbelt town of Northam. She has worked at WAC's Wheatbelt Aboriginal Health Service for 14 years and started working with the Aboriginal Immunisation Project at the Public Health Unit in March 2023. Thank you.
Hi there, everybody. So you've heard who I'm Marg, and this is Wendy, my lovely colleague. Okay, well, thank you very much for inviting us today. I'd like to begin by acknowledging the traditional owners of the land on which we are meeting, the Whadjuk people. Pathogen for us to immunise our Coolangar. So through listening to our families, we've been able to make changes to the way we deliver our immunisation services at our project sites. Like many regions, immunisation rates in the Wheatbelt steadily declined during the pandemic. So in order to address the decline, the Wheatbelt put in a submission to undertake the project that we're going to talk about today, with the hope that trialling some different ways and innovative ways of doing things would see an increase in immunisation rates. I'd like to acknowledge Anne Foyer, who's in our audience today, our Rick, who first brought this project idea to me. And as the going says, from little things, big things grow. So the Aboriginal Childhood Immunisation Project commenced in February, and it's been conducted at across 2 pilot sites. They are Avon Central, which is in Northam and the surrounding towns, and also the Western Wheatbelt, which is in Moora and the surrounding towns. So 2 hours apart, which has been a little bit challenging. The main goal being to reduce the gap in immunisation coverage rates and to add value to our existing services, that is our maternity and child health programs. So the project aims broadly just to increase our childhood immunisation rates amongst our Aboriginal children by promotion of the immunisation rates, increasing our opportunistic immunisation and improving our cultural security by appointing an Aboriginal health worker within the public health unit, which is Wendy, which we've not had this role before. The project methods. So we started off with doing a program logic workshop, which was held to map out aspects relating to immunisation and to help guide our evaluation. We then established a steering group to provide governance over the project, including our clinical guidance. Next, we went on to consultation, which consisted of working with community members, our Aboriginal families and elders, and stakeholders, which was mostly our child health nurses, to complete a survey to guide the project. Questions were formulated to capture attitudes, beliefs, behaviour and knowledge around immunisations. Across the 2 pilot sites, a total of 54 community members were surveyed and 30 child health nurses. I'll now hand you over to Wendy, who will talk about the consultation outcomes and where to from here.
Firstly, I'd like to start off with sharing some of the comments from some of the surveys that we did. One said have walk-in clinics not attached to the specific hospitals to provide a home visiting service. Pop-up clinics in the community, availability of appointments and transport. Having a strong relationship and trust with the community nurse professional that's doing the immunisations, and being a convenient and immediate service. Families need to feel safe and comfortable, friendly staff, culturally appropriate resources, services delivered by the Aboriginal health workforce, increased education that explains more about the vaccines. The majority of the staff and clients knew when VUB was due and how to access services, And this was because of the SMS texts, use of the purple book, emails, and home visiting. Also from the consultation process, the themes that were identified then formed the basis for developing an action plan for the two different sites. These were access, cultural security, knowledge. Access to services were improved by having a collaborative approach and the inclusion of an Aboriginal health worker, myself, in the planning and attendance at the appointments, working alongside midwives and the child health nurses. Implementation of standalone immunisation clinics, incorporating outreach, including home visiting, and planning pop-up clinics. Stakeholders and families were further educated about the transport process at Wheatbelt Aboriginal Health Service. Cultural security. Walkthroughs were conducted at our child health clinics and waiting rooms, and from it was identified that cultural signage was lacking. Consequently, we have purchased some educational resources to use within the clinic. Yarning sessions have been conducted with child health nurses to improve their knowledge around ways of working with Aboriginal families. Knowledge. Existing resources used by Wheatbelt Aboriginal Health Service were reviewed and redeveloped and meet the consultation outcomes. A focus has been developing resources that are visual, easy to understand. Where to from here? A simple evaluation form has been developed to obtain feedback on the experience with our services using a smiley face rating. Questions are being asked around cultural security, clinic environment, and immunisation information being provided.
So some of the success from the project so far include an increase in number of children attending for immunisations, a reduction in the number of children on our overdue immunisation list, the establishment of standalone immunisation clinics, because previously immunisation was delivered as part of a child health appointment with the developmental checks. And most importantly, the project has increased communication amongst our teams and encourage the staff to think more about service delivery modes and how we can provide culturally safe services. I'd just like to also say that we have asked for an extension of our project through till next year. In June, hopefully we are approved. Obviously, it's difficult to quantify the time taken to build engagement and to develop relationships, which are key to the project and beyond. And finally, I just want to acknowledge that there's a lot of staff that are involved in this project that aren't here today. Our clinical nurse manager for public health, our RIC, our health promotion staff, and also we have a grandmother liaison that works in the Moora district who's supporting the project in that space. Thank you. Thank you.
We have time for one question if there is one.
Thanks. Oh. Thanks for that great presentation. I was just wondering, you've got your two sites, have you had any interest from other areas across the Wheatbelt that have become aware of the program?
For this program.
Yeah.
So obviously we've chosen the two sites where the immunisation, well, one site, immunisation rates are low. So yes, the whole Wheatbelt is well aware. Wendy hasn't shared, but we've done a lot of development in resources, which is actually got here if anybody's wanting to have a look later. So a lot of the learnings from the project so far will be rolled out across our other child health clinics and the ways that we do service delivery. Thank you.